Hello Malaysia, hello world. Apa khabar? Apa khabar? Come rain or shine, MCO, CMCO or EMCO, we are still here with you and our ECM talk continues. Thank you for your loyalty and support to our channel as always. We have another interesting topic for this week's program, the battle against COVID-19 and its stigma. I'm Rajesh Shahrul, your host. A rise of social stigmatization of people infected with COVID-19, suspected of being infected, cured, or even those providing healthcare to the infected, stands in the way of the fight against the pandemic, besides being a signifier of a lack of empathy in society. Reports of such social stigmatization of and discrimination against COVID-19 patients or suspected, along with doctors and nurses, the frontline fighters, are alarmingly aplenty. A disproportionate fear rising over a lack of information and abundance of misinformation has triggered the rise of the social stigma, which is not only hampering the fight against the disease, but also obstructing people infected with or suspected of COVID-19 infection or suffering from other illnesses to avail proper treatment and support. Moving on, it is a great pleasure to introduce my guests in today's program, who would be in a better position to tell us more about this subject matter. The COVID-19 survivors themselves, Encik Hamdan and Encik Afifie Chan. Gentlemen, welcome to ECM Talk and thank you for being here in our program. Apa khabar?
Thank you for being us.
Alhamdulillah. Let me begin with my first question to start off this program, yeah? Now, maybe I will start with you, Encik Hamdan, my first question.
Yeah,
perhaps you can share with us your experience being a COVID-19 positive patient. How was the pain, the medications and treatments, Encik Hamdan?
Okay, for me, myself, I was infected from my father who went for a meeting.
Right.
We got to know from that circle of people. They were instructed to get tested immediately after attending the meeting. So me being the direct contact of my father, we had to get tested too. But due to the sudden rise of getting tested at that point of time, my result came in quite late. So while waiting, I was already started having symptoms. I got the high fever first, and then I started to have cough, and then the chest pain came by. Once they called me to tell that I was positive, I was actually really relieved, not being scared, because of I was in pain. I can't breathe at the point of time. But my fever went away because at the point of time I slept in a room without air conditioning, so I sweat away all the fever. And to share the pain, it was very painful because as some of you might know, I was in a category 3, which was my lung was infected, but my oxygen level was still fine, so I do not need any additional oxygen or any help for breathing. The pain was very excruciating due to it is very hard to describe, but I might say for people who have asthma, they can relate with it. You can't breathe, and because of the cough, you have the dry cough. It is very painful because a normal cough, you have you have phlegm to clear your throat. But
Right.
for this COVID, you don't have phlegm to relieve yourself.
Right.
The phlegm is non-existent, so you don't feel relief. So you want to breathe, but then you want to cough. So it was a very painful thing to go through. And the medications, once I was in, the first night around at 3 a.m. or 4 a.m., they came in the room and x-rayed me. And a few hours later, when the doctor did the round, I was brought with the bad news that my lung was infected. He even showed the image. So I was devastated because of, the fear of dying is there once you are being told with such news. And the doctor told me that they will start the medications for SARI, severe respiratory infection. So the medication at the point of time was the same for people who are the HIV medicine. So I was told that it will be very tough to the body to go through. You might get very weak, and also you might have diarrhea. And I did go through that. The first 3 days of taking medications, I was out blank, zero. Most of the time, I only wake up just to have some food. I lost a lot of weight during that time, and the nurses was very helpful to remind, to ensure me to take the medicine. I think during that time, it was the thought of death might be just around the corner for me. And at that point of time, because I was like one of the earliest in Malaysia, and when I came in, the cases was, even my parents was case number 44 and 48. So myself was below 100. And the thought of even when I told my friends, some of them was like, wait, I can share it to my children. One day I have a friend who had COVID, because at that point of time, not many people who had COVID. And people were thinking that COVID is something only the Chinese from China, which we're gonna have it. Not gonna be like what happens today. Today is something normal that everyone have someone that they knew who have COVID today. But so the
sorry, Hamdan, when was this exactly, Hamdan? You got this?
Was March 2020.
Okay.
Yeah, because the at that point of time, only right after Chinese New Year lah.
Correct.
So
that was actually the beginning, for Malaysia, kan?
Correct. Like I mentioned, for myself, it was a sad thing because the thought of death is always there, and I am very grateful. And even at that point of time, there was no mention about how the death of people with COVID being managed. While I was in, I was thinking, what if I was dead? Am I going to be burned, or am I going to be buried normally? I did ask even to my close friends. Then when I mentioned about it, am I going to be burned because of the virus, right? And then my friend was joking to me, kau ingat ni Ebola ke? Then I was like, the next day happens to be the Mufti of Negeri Sembilan came out with a fatwa saying that the people who are dying out of COVID should be managed as per Ebola. They have to be wrapped in ways to respect them lah in our Malaysia country. So no burning of the death. So it was not funny. The thought was really scary. Because at that point of time, to remind you to remind you, because it was an early I was the early adopters in Malaysia, so there was no death toll yet. Only when I partially recovered, when the cluster tablet came in, then there was the first death toll. it was scary for us.
Right. Okay, maybe, thank you, Hamdan. Afifie, maybe you can tell your side of the story. What did you go through?
Alright, so I'm a bit different compared to Encik Hamdan because I'm at first when I get the symptoms on 29th December 2020, I'm in level 2. So basically when you have the symptoms like cough or fever, you will be categorized as category 2. But when you get pneumonia or your lungs got infected, like Encik Hamdan, then you will go into level 3. But for me, my lungs is still fine. So on 29th, all started with on the night before. I'm pretty normal. Like I didn't expect anything at all. But when I wake up in the morning to go to work, I wake up with a sore throat that I cannot even talk. It's like a sore throat, sudden sore throat. So I think it is abnormal. So I directly isolate myself because I expect that probably it is something related to the virus. So and then I went to the clinic to get like a normal checkup because I think it's like an infection. But before I entered the clinic, I told the doctor and everything that I think this is something abnormal. But the doctor checked and she said like, oh, there's no infection on my lungs. So probably it's just a normal infection. And then like 3 days later, I got to know from a close contact from my family member that she was diagnosed with COVID. And then I'm her close contact because she's my family member, right? And she's a frontliner. So then KKM called me on the next day for swab test appointment. So I did my swab test on 4th of January. And on 6th, I was called by the doctor and delivered the unfortunate news that I was positive. But when I got the news, I've already recovered from all the symptoms. Like I started with sore throat, as mentioned, and then it developed into a cough. And then I started to have a chest pain and muscle pain, especially close to the lungs. And then how I can describe the pain is like, can you imagine your muscles being poked with thousands of needles, especially close to your lungs. And at the same time, you have cough. When you cough, right? So automatically your chest will be pumping. So can you imagine your cough and at the same time your body is like poking you. So it's really, really painful. Like Encik Hamdan said, even when I describe this, it never close to the pain that we feel. So I'm in level 2 during that time. So you can imagine if you entered level 3 and level 4 or level 5 even. So that's going to be much more painful. I'm lucky I'm in category 2.
Yeah. Yours, well, you got this only recently, Afifie?
Recently, it's from my first symptom was on 29 December 2020. So I entered a new year with the virus.
MashaAllah. Yeah. Alhamdulillah, you guys got out of it. Yes. Yeah. All right. Okay, I will now proceed to the second question. Maybe I'll continue with you, Afifie, the second question. Being an ex-COVID-19 patient, do you ever experience any negative treatment or perception from people around you? And how do you deal with it?
Alright, I'm lucky. On my case, I would describe myself as a lucky person. Since the beginning until the end, I'm a lucky person that when I discharge from my apps, it's a PKP. So I cannot even meet anyone. So directly after I discharge, I have to come back home. But I didn't get any stigma or negative feedback from people because before I go out, I already told them about. I've already posted on my social media on how the discharge procedure going to be about the infections level. That when I discharge, I cannot infect anyone. Although the virus going to be in your body for up to 3 months, so I cannot infect others after I discharge. So I already told them in my social media, and people are aware of it. Especially those close friends and also my neighbors and family. So that's why I didn't get that kind of treatment. Even when I got back home, my parents are still in the hospital. So I'm alone at home. my neighbors called my mom and saying that she cooked lunch and she wants to deliver it to me. So she delivered in front of my house, and I told her like just hang it on the gate. I can pick it up later. But she said like, no, you cannot infect me. You cannot infect. You are not. Although you are COVID patient, ex-COVID patient, you cannot infect me anymore. So just come here and take. I want to see and talk to you. And then yeah, so we talked through the gate. So she asked me everything. So even she asked me if I want to have dinner. So I have a good neighborhood. So I'm quite lucky in terms of that. But
Absolutely.
people on social media do texted me and DM me saying that they experienced that, especially those people that have to go to the office and start working. Then they get the same treatment from bad treatment from their colleagues and everything. So but I believe that as you mentioned, Raja Shagul, in the beginning in your introduction, that I think this is not it's not the attitude of Malaysian, because we are rich with courtesy. And then I think this is more of a lack of awareness and knowledge about the discharge procedure. Because when I posted on social media, my close friends and families know it already. So I don't get that kind of bad treatment. So I guess this is what we need to do. We need to spread more awareness to everyone. It's not that they want to treat us like a criminal, but it's just that they are lack of knowledge and also awareness. Because I get the awareness because I have it. Then I go on research how it's gonna be. But if I didn't get it, I don't know what will happen. I don't know the discharge procedure. I don't know everything. So I think people should be more aware and follow KKM page or Twitter, their news, because they always spread the awareness actually.
Encik Hamdan, what about you?
As an early adopter of the virus, definitely the stigma thing is real. To be honest, I'm not going to mention names or who, but then when you first got out of the hospital, even myself, when I got out of the hospital, my family was in PKP at that time. However, due to the whole family got infected, people were not eased with the condition, you know. Because it's something new, something
Absolutely.
that as Afifie mentioned, the awareness is not there yet. So people don't know even why when I got viral for my sharing in 2020, I did what I did at that point of time to accept being interviewed for multiple news channel and whatnot. It's because I wanted to create awareness, and I wanted to for people to know that this virus is real and this illness is not something to play with. And the stigma that I am very sad that I went through, that was quite recent. I think a month ago. I went to a clinic due to I was going through some. I was having some discomfort in my throat. So the funny part is, as you know, when you go to the clinic, they will ask you, have you ever been in contact with people with COVID and whatnot? So that part I have to say no lah. But then that particular staff suddenly asked, have you ever been infected with COVID? How can I say no? So, but the thing is,
oh my God.
I have recovered. I told her, yes, I was a COVID patient, but then it was 1 year ago. And then suddenly she was like, her face changed, and she excused herself and went into the doctor's room, and I believe they discussed something. The next thing I know, I was told that sorry, we can't treat you. There is a procedure that you have to go back to the government clinics to get treated for any illness. I was like, no, there's no such thing. I was here last week for dressing. I had some cuts. So, and then they were like, yeah lah, last week you were here.
Yeah.
And then And then I was like, okay, then why can't you treat me now? They mentioned sorry a lot of times. Sorry, we can't take you in, so you have to go to the government clinic.
Right.
I was there. I mean, I felt very. Yeah, this is the true story of stigma. But when I went to the government clinic, the doctor told me perhaps they are not, as Afifie mentioned, well informed. That when the information doesn't go through really well between, even as I mentioned to you, this is a clinic, not normal people. What if normal people being shared information that is not correct? As we can see, some people right now are being shared with informations from ex-COVID patient who are asymptomatic, which means they don't have any symptoms. They came into the hospital and came out. They say, hey, nothing lah COVID ni. I tak ada makan ubat pun, masuk dalam tak buat apa-apa, tahu-tahu keluar. Ni penyakit apa ni? Tak payah risau. You know, those when people are misinformed. Yeah. So these are the things that, I mean, I'm not saying it is dangerous, but then it triggers to how they think about the virus, or how they perceive the virus is. So the education of this this COVID needs to be more. I mean, I believe in the mainstream media, not only reporting about the virus, but then as Afifie mentioned also about how it is, once it's cleared from your body, it's done. Nothing.
What are your hopes and perhaps some advice for current and also ex-COVID-19 patients?
All right, for the current patients or the patients right now, I would say, I know the feelings. If you feel we're all gonna feel the guilt at first, because we always think about others. So don't feel guilty if you got it. Don't because you don't expect you're gonna get it, and hopefully you don't. If the close contact is positive, don't feel guilty, because like us, we also get it from someone. So it is a fate that we got it. It's a take it as what people call as ujian. Right, we are being challenged in that way, and then take it that way, and then fight to recover. The death toll is only 1% right now in Malaysia, so don't ever put yourself in that 1% thought, but be in the 99% who survive. Right, and then to everyone that is ex-COVID patient, please try to educate people more out there, because we have the voice right now, because people would believe in the first-hand experience rather than listening to people that make assumptions online. So we have the voice.
Now, I thank you, Afifie. Now, Hamdan, what's your take on this last question?
Okay, for the current patient of COVID-19, I would say be positive, not COVID positive, but mentally you have to be positive. Always be grateful that you are in condition better than someone else. You might think COVID as the worst thing that happens in your life, but you have to remember somebody is going through much worse phase in their life compared to COVID. There are cancers, there are many other illness. People got into accidents and whatnot. So you have to be grateful for your condition, and like the Prophet always mentioned, don't look up, look down. If there are people much worse condition than you, then you'll be grateful and you know your position, and that is what kept me throughout my experience. I always think that way. And what I'm going through is just a bit. There are people out there is going through worse. And for those who have gone through as a COVID patient, still take care of yourself. You might get infected again, and share your experience. I mean, tell the truth to the non-believers, and hopefully with the vaccine coming soon, we get to see a new light in the future. Near future. So.
Thank you, Hamdan. Thank you, Afifie. Thank you. Thank you very much. Realizing that the stigmatization of COVID-19 would only add to the threats and risks, the government is continuously trying to ensure effective dissemination of information, restore people's trust in the health system, and reduce their fear through a better and effective management of detection and treatment. People must be rightly aware of the disease, follow the required health guidelines, and act compassionately and with empathy towards those infected with or suspected being infected with COVID-19, the cured, the caregivers, and their families. Once again, gentlemen, thank you very much for participating in our program, and we wish you all the best and God bless. ECMians, please don't forget to like, share, and subscribe to Edu Channel Malaysia. We look forward to see you again in our next program. Take care and stay safe, everyone. Jumpa lagi.